So, welcome everybody. I'm Flavio Gazzani, and it's my pleasure to introduce you and talking about this lecture about the antimicrobial resistance on health and food security. So, as you can see from the title, this lecture we will cover different aspects of the antimicrobial resistance. So, we will focus first of all on healthcare system. We will see how the antimicrobial resistance affect all the food supply. We will see how it works, the transmission from the animals, the antibiotics, for example, to the humans, and how this create an emergency in the last 20-30 years, because there is continuing increasing amount in the overuse and misuse of the antibiotics, for example. So first of all, we will examine and understand what we mean for AMR. We will talking about AMR without repeating again all the antimicrobial resistance. We explain the difference between the misuse and the overuse of antimicrobials and how these contribute to the increasing resistance. We investigate also their resistance and how they affect all the food supply. And then we will focus the attention on what is called the One Health approach. This is very important because we will talking about the antimicrobial resistance. We will see how this affect the entire food supply, how it's very dangerous for the human health. But at the same time, it's very important that we focus these issues into the One Health approach. We will present a couple of case studies. We identify also the factor contributing to the development and spreading of AMR resistance, including the inappropriate use in humans and animals. So we will see we will cover two different issues. One, for example, the antibiotics, the overuse in human health, but at the same time we will also assess how the agriculture, the animal agriculture continue to overuse the antibiotics. And then we will focus again, we will go back again into the One Health approach. So first of all, let's have a look what we include for the antimicrobials. Antimicrobials included all the antibiotics, antivirals, antifungals, and antiparasitics. So it's not just about the antibiotics, even if, of course, generally, especially in this lecture, we will focus more on antibiotics because it's used also in in the veterinary medicine and also in animal farm. But generally, when we're talking about the antimicrobials, include different aspects. And what is called the AMR generally refers to the ability of microorganisms such as bacteria, viruses, parasites, and fungi to resist the effect of the antimicrobial drugs. So the problem is that generally in the nature, when we have any sort of viruses or bacteria, generally, even if the human go to the doctor prescribe any sort of maybe some specific antibiotics. The problem is that as soon as continue to pass the time, as soon as our body they start to create a resistance towards the antibiotics. And the problem is correlated also to the human health is the fact that if we use too much antibiotics, our body can create a resistance. It means that in the near future, the antibiotics will never work as it should works. And generally, the problem is also to the drug resistance pathogens. So let's have a look. This picture is quite easy to understand what we mean for antimicrobials and what we cover. So we have all, as I already said, because it's very important that we focus and we understand what we're talking about. We're talking about the antivirals, so any sort of virus, for example, the COVID-19, HIV, and so on. We're talking about the antiparasitics, so any sort of drugs, for example, that prevent the infection caused, for example, by the tick, for example, by the mosquito that carry on the malaria, and so on. Antifungal, that it's all the fungi, any sort of the family of any sort of kind of fungi. And then we have also the bacteria, for example, the urinary tract infection, the tuberculosis that is spread around the world. So there are several different aspects how some specific drugs can cover or can be prescribed to attack some specific disease in terms of a virus, parasites, antifungal, and antibiotics. So this is all the family of the antimicrobials. Let's have a look now, because the aims of this lecture, of course, this lecture is not about medicine, or not talking about specifically, for example, from the biological point of view or from the medicine point of view. The aims of this lecture is to show you the importance of the antimicrobial resistance, how we can in some way manage this problem, not just correlated to the human health, so in terms of medicine for the human health, but also from how we can manage and reduce this resistance in all the farming, especially the farming specialized in any sort of animals, because as we will see, generally it will pass this resistance from the animals into the humans. So first of all, when we're talking about overuse and misuse of antimicrobials, we're talking about the inappropriate use of this sort of drugs in healthcare, in the agriculture, in the veterinary practice, that contribute to the development of resistance. So this resistance is in some way amplified by the use that is not correct. Could be not correct in terms of using too much, for example, antibiotics, or for example, can be created by the fact that we use the wrong antibiotics for some specific virus that doesn't work. So if we take too much or the wrong kind of antibiotics in our body, if we continue to use these antibiotics, our body reacts in terms of creating a resistance. It means that the next time that we'll take or animals or human will use the antibiotics doesn't work that much because there will be a resistance. So there is, how you can imagine, a concern from the public health that poses significant threat in the public health, because it limits the effectiveness of antibiotics and antimicrobial drugs. And also the problem is correlated to the fact that, for example, is prolonged the illness. There is higher healthcare costs, because as soon as a patient, instead of stay, for example, 3 days or 4 days in hospital, they have to stay 10 days, of course, this represents a cost. This represents also problem correlated to the numbers of the hospital. So you can imagine how, when a person, for example, if you're talking about human being, are treated with the wrong antibiotics or they have resistance, it means that he will take more time to recover from some specific disease of course, that coming from viruses, for example. This is create tremendous impact, first of all, on the public health sector. Then there is also the risks of increasing mortality, because the infection that were once easily to treat with antibiotics may become deadly due to the development of the resistance. I show you here just a number, just to have an idea how is important this lecture, how is important that you start to understand, and of course you have time, you will have time after the lecture to read all the readings, the recommended readings, because we're not talking about some marginal issues, some marginal disease, or some drugs that create a resistance. We're talking about that, for example, the AMR was directly responsible for 1.27 million global death in 2019. So we're talking about 1 million persons that died, and there was also contributed, that means that was not direct caused by this resistance, of almost 5 million deaths in 2022. In 2029, sorry, this is the reference, this is the Antimicrobial Resistance Collaborator, that this is an association specialized in this research. And just to have an idea, this corresponds to 2.4 times the number of deaths due to tuberculosis, influenza, and HIV/AIDS combined in 2020. So just to have an idea, the magnitude and the impact that the overuse of and the resistance to the, for example, to the antibiotics, how many people die every year in just in a single period. We're talking about more than 1 million fatality caused by the resistance to the antibiotics. There is also a huge economic impact, you can imagine. And the cost of treating complication to the resistance to the infection can exceed 28.9 billion every year. So we're talking about a huge number in terms of economic costs, economic impact to the healthcare sector worldwide. But we can imagine how it's important to, in some way, start to mitigate and control, and in some way create a framework or create a collaboration, because this is not just a national problem, this is a worldwide problem, to try to reduce this tremendous impact on the health. Let's have a look now how the antibiotic spread, how it works. So why? Because this problem is not just correlated to the human health. We're talking about a completely different situation, because generally the farm animals receive the antibiotics. Why receive the antibiotic? Because you can imagine how the intensive farming, this big company that are specialized, for example, in pig and cow, to the production of the milk. We're talking about a company that generally have thousands and thousands of animals inside their farm. So the risk that an infection can affect maybe the 20-30% of these animals, first of all, represent a huge impact. So first of all, because this is a private company, the aims of this company, first of all, is to create a profit. And the problem is that much of the time it happens that this company, they think more about the profit instead the health, because to avoid any sort of viruses that can spread into the farm, so they overuse, for example, the antibiotics. So what's happened that the meat products that are not handled or cooked properly can transfer the antibiotic resistant bacteria to humans. That's the most important aspect that you have to keep in mind, because the problem, if it is well cooked, for example, the meat, there is any problem. There are several times that maybe the meat is not properly conserved or not properly cooked, that the antibiotics, the resistance, is transferred to the humans. But there is also another aspect that we can transfer, so not just through the eating of the meat, but also through the fertilizer and the water. For example, the water contamination from the farm, because the contamination, for example, the urine or any sort of discharge from the farming, if go into the water and there is the water contamination that is typical in several regions where we have the intensive farming, this can in some way create a bacteria that are used on food crops. The contaminated crops can transfer antibiotic resistance to the humans. So there are two different ways how the the antibiotics from the animals can reach the humans. First of all, through eating any sort of meat, if it's not well cooked or if it's not well conserved and cooked, maybe not in the right time, but also the discharge from the farming activity can contaminate the water. The water contaminated is used from in the crops to the production of the crops, and from the crops go straight into the humans. So that's the circle. There are different ways how this can affect humans. Now let's have a look at what we mean from One Health approach, because if you can imagine this problem, so imagine that this problem is not just correlated to some specific region at the national level where there is the intensive farming, because especially with the globalization, you can imagine now when you go in a sort of a supermarket, when you buy the meat, generally doesn't mean that this meat comes from your own country. The meat can come from overseas most of the times, especially if you live in a country where there is a less amount of pig, of chicken, of cow. So maybe it comes from 5,000 kilometers from your own country. And the problem is the same, because everybody around the world use and overuse antibiotics. So this is stated everywhere around the world. So it means that in some way we have to create an approach that we can in some way manage this problem, not at the local, national level, but worldwide. But it's not just a problem correlated to the geography. This problem is correlated, as we see from this previous slide, that this problem covers, first of all the animal farming. Second, all the environment, for example, when we're talking about contamination. And third, we'll cover the aspect of the humans. So the One Health approach is an holistic and a collaborative approach that recognizes the interconnectedness between and among humans' health, animal health, and environment. So this is pretty important, because this is the only way how we can in some way mitigate or solve or try to solve this problem. Otherwise, if we will cover or if we will focus only, for example, in veterinary medicine, we will focus only in all the animal production, animal disease, and so on. But if we would like to, in some way, solve this problem that especially is transmitted from the animals to the humans, we have to use this holistic approach. So when we're talking about every time you read something about One Health approach, it means that will cover from the analysis, from the research, from any sort of policy, the human health, animal health, and the environment. Also, the zoonotic disease is particularly important because, as we see on the next slide, diseases have a significant impact not just on the humans, but also on the animal population. So the key principle of One Health is, first of all, that there is an interdisciplinary collaboration among nations, among different professionals, among different institutions and research around the world. These have an holistic perspective because it's not just focused on human health or in animal health or some specific on the environment. This approach will cover all these three important spheres that interact each other. Then there is another principle of the One Health is the prevention and the control of zoonoses. The zoonoses represent generally when there is an infection disease that can be transmitted between animals and the humans. So when you read, when you heard about zoonoses, it means that we're talking about a specific disease, for example, that can be transmitted from animals to the humans. And this disease can be caused by the bacteria, the viruses, the parasites, the fungi, and the transmission can occur through the direct contact with animals. So it's not just we're talking about only eating meat or so on, but we're talking about any sort of different disease. For example, if the COVID was spread from the bat to the humans, it means that we are talking about zoonosis. The same can happen through the water contamination, to the exposure to the vector like mosquito or tick. So this is very important, and the prevention and control of this One Health approach, of course, include the control of any sort of infection that can be transmitted from animals to the humans. And also the environmental stewardship, so the health of the ecosystem is integral to the health of living organism, and also advocate a responsible environmental practice to maintain the ecological balance and to reduce the risk of emergency diseases. So the One Health approach will cover several aspects. The aspect, first of all, in terms of disease that can be transmitted from animals to the humans, the impact on the environment, for example, if you're talking about agriculture, intensive agriculture practice into the water contamination, any sort of, for example, insect that can transmit any sort of disease to the humans, and how, of course, the healthcare sector can solve or can manage this emergency. There is also, of course, a global perspective in terms of the organization, in terms of controlling, or try to confine this problem into some specific geographic borders. Just to thinking about what's happened a few years ago with the COVID-19, how this virus was spread in a few weeks around the world, because it's always you have to keep in mind also the aspect of the globalization, because in the last 20-30 years there are millions of people that moving from one country to another one, so the amplitude of this disease is in some way much higher than maybe 30-40 years ago, when there was less people that continue to move and are in contact each other. So the One Health approach will cover all different aspects, and also is an interdisciplinary collaboration control, especially from the human and animal health point of view. This is a graphic representation to show again how the One Health cover the human health, the environment, and the animal health. They interact each other, because when we're talking about the environment, there is a climate change, water pollution, extreme weather event. Of course, if we're talking about a region that they got water contamination, for example, extreme weather event such as flooding, tornado, amplify also the area in terms of affected. So there is several issues that in some way interact each other, and the One Health approach aims in some way to analyze and to assess the problem, because we're talking about in this case studies about the antimicrobial resistance, not just from the medicine point of view, but also from the environment and also animal science and veterinary point of view. So let's have a look now, for example, because now we just make an introduction to talking about how these viruses can be transmitted from animals to humans, how affect all the public sector, and how this not just localized at national level, but how this is a problem, is a global problem. But of course, you can imagine how also this resistance affect the food security. In which way? So how the impact, how can the antimicrobial resistance affect the food security? And it's very important to understand the reason why we take the attention, and the reason why we have to consider the AMR problem, not just in terms of health of human and animals, but also in terms of food security. First of all, there is the reduced effectiveness of treatment in agriculture. So in agriculture, the antimicrobial agents are commonly used to treat and prevent disease in livestock and crops. So it's also used in crops, used in any sort of animal farm, because of course the farmers would like to reduce the risks that a virus maybe can kill part of their animals or some percentage of their crops, so they use everywhere. There is any sort of country, also in Africa, everybody use this, for example, antibiotics or antivirals. Of course, if a disease is not well managed, so we can make mistakes in terms to using their overuse, and then there is an indirect impact into the human health. But if we use or misuse, it means, for example, if we use the wrong antibiotics for a disease, for example, for the pigs, it means that this virus, for example, can kill part of the pigs. It means that this had direct impact on the food supply, because, of course, the farmers will have less number of pigs to sell or to kill and treat in a different way into the food supply chain. There is also the losses in livestock productivity. So this resistance, it means that if we continue to give the antibiotics to some specific animals, it means that if these animals develop inside their body resistance, the antibiotics that we will treat, for example, in a second time, it doesn't work. It means that there is the risks that these animals will die. And this, of course, reduce the productivity, reduce the effectiveness, but also reduce the stock of the amount of animals that the farmers can sell can be transformed into the supply chain. So the problem is not just related, when we're talking about the antimicrobial resistance, it's probably not just correlated to the risk to the human health, because, for example, the antibiotic doesn't work anymore as should be. But the problem is the fact that also the animals develop this resistance. It means that new viruses can be treated with the same, for example, antibiotic, because it doesn't work. And this is, of course, create the risks to the reduction of the food supply. And the mechanism of antibiotic resistance have different way how affect the human body or the animal body. There is the mutation, the horizontal gene transfer, the selection pressure, and also the adaptive evolution. This is just list this one. Of course, this is not the specific lecture where we were talking about this one. Just if you'd like, especially if you'd like to have a look at the horizontal gene transfer, how it really works, there is I also listed this publication on the reference, and also in the recommended readings. Now let's have a look at the factor, because of course this lecture is not about medicine, it's not about biology applied to the medicine, but it's much more on the policy and the approach of the healthcare sector through the antimicrobial resistance, how we can manage. So the factor that are contributed, as you already see, is the overuse and misuse of antibiotics. There is also incomplete treatment courses, so not completing a prescribed courses of antibiotic can leave surviving bacteria more likely to be resistant. So there is another problem, so not just about misuse or overuse. For example, also the inadequate diagnostic tool. So if your doctors don't have the right maybe decide to give you the wrong, for example, the wrong kind of antibiotics, because there is not just one general antibiotics, there is several different antibiotics. If they prescribe the wrong antibiotics, this doesn't work. This create in some way contribute to the resistance, because your body receive an antibiotic that doesn't work for this specific bacteria, for example. In some way, your body will start to develop this resistance. It means that your body in the near future will have resistance toward any sort of different antibiotics. There is also another factor that contributing to the development of the antimicrobial resistance is the poor infection prevention and control. So you can imagine how in all the country with inadequate or low level of hygiene practice and also in healthcare setting and communities, of course, create an ambient where this infection and disease can be in some way spread easily, and also the magnitude of this infection can be higher in, for example, in a country where there is a strictly, for example, hygiene practice or strictly hygiene protocol inside the healthcare or inside the hospital. So there are different factors that contribute to development and increasing antimicrobial resistance. There is also the lack of new antibiotics. For example, if there is a new disease, maybe we don't have exactly this, the specific antibiotics. We use maybe some similar that doesn't work. And this, for example, this lack of innovation contribute to the persistence of existing resistant strains. There is the globalization and travel, as already say, so the fact that millions of people continue to interact and to move every day in a single moment. They are continue to meet. So just thinking about what's happened, for example, in an airport such as Dubai, where they reach 186 countries. So there are thousands of flights, the thousands of people that meet each other. So of course the disease is it's easier to have a contact between person that transport some disease. There are several countries that have an adequate surveillance and regulation. The regulation not just about the antibiotics or antivirals, but also the adequate surveillance, for example, on how the farmers, the amount of antibiotics that the farmers using on the animals for the animal production. There is also an adequate surveillance when there is some specific disease or some specific virus. So there are several factors that contribute to the development of antimicrobial resistance. Also the environmental factor. So you have to keep in mind that this problem is not easy. It's not easy to treat. First of all, because we have several million people that meet each other, so the contact is completely different compared to the last century, for example. There is the fact that the globalization in terms of the food supply chain and all the animals that are sell and buy through the different country, and each different country have different level protocols in terms of surveillance, in terms of vaccine and so on. So you can imagine how it's pretty hard to combat and try to manage the antimicrobial resistance. So every time when you heard about the antimicrobial resistance, you have to keep in mind different issues, so not just the health issues related to the humans or to the veterinary medicine, but also the causes, the factors that amplify this resistance. And also the role of overuse or misuse of antibiotics, as I already say, have their own weight in terms of creating and amplifying this effect. I already say before that the overuse, generally definition of overuse refers to an excessive or unnecessary use of antibiotics. For example, the misuse involved inappropriate antibiotics. So there are different ways when we're talking about misuse or overuse. Anyway, we're talking about a way how we are using these antibiotics for animals or for humans in a wrong way. And this wrong way to use the antibiotics increment and also increase the risks that the body, the animal body or the human body create their own resistance. It means that they will not work. So the impact on antibiotic resistance, of course, have their direct impact in the healthcare sector. They have a direct impact on the human and animal health. So, coming back again to the One Health approach, is very important that when we're talking about the resistance of this, for example, antibiotics, it's very important that we have to understand that the problem is not just on humans correlated to the fact that, for example, the doctor prescribed wrong antibiotics, or maybe you take too much antibiotics and your body receive and develop this resistance against the antibiotic. The problem has come from all for example, the animal farming, because we consume, for example, the meat, and if most of the time, especially the young kids, if they eat too much meat, in some way there is a high risk that this resistance come from to the fact that the meat that they consume is full of antibiotics. So because they also, the veterinary in the farming, especially in intensive farming, they have an attitude to treat any sort of a virus through an exaggerated amount of antivirals or antibiotics into the farming systems. So let's have a look at the first case study, just to have an idea, because otherwise we're just talking about generally. So let's start from the farm in Netherlands. First of all, you have to, from this picture, you understand you see on the left side there is the percentage of concentration and density. The density generally are measured in terms of numbers of animals per hectares. So you can see here how it's quite easy to understand how the Netherlands and part of the Germany are the higher density in terms of livestock. Of course, this directly is correlated to the fact that this intensive farming, of course, which sort of problem can create? First of all, can create a problem correlated to the overuse of the antibiotics, but at the same time there is a huge impact in terms of water contamination that comes from through this farming. So if you remember the first slide, there is two different ways how this resistance can be developed. If we're talking about, and we will focus the attention, for example, in Netherlands, I use this case study just to have an idea how this country, for example, is the first producer of animal in terms of animal farming. So the antimicrobial resistance in implication for treatments, first of all, is in terms of urinary tract infection, Escherichia coli. This is the typical infection of the animals that is usually treated with specific drugs in a medicine, in a veterinary medicine. So, for example, the resistance level of ciprofloxamine is a first choice is antibiotic for treatment that the complicated UAT in adult primary care. In this slide, generally I treat and I use all the different examples how the different antibiotics or antivirals are used in human medicine, in human health in Netherlands. I use this one as a Netherlands case studies. So this is all the different drugs and medicine that are used to treat different disease in ACU patient, also in general in patient hospital or any sort of infection, urinary infection. So there are different kind of antibiotics that are generally are used in the healthcare sector in the Netherlands. Now let's have a look. The antibiotics that in Netherlands are used in the animal, especially on the livestock. So from the livestock, for example, This research is very important that you're going to read, because you will find all the data and how they treat this data, and how it's much easier to understand these case studies. They found out, this research, that there is a resistance proportion to the Campylobacter jejuni isolates from the cecal sample of broilers and so on. So the salmonella, for example, from livestock meat in 2020, they have showed that a higher resistance level were observed for the ciprofloxacin. So this is a different antibiotic that are used in the Netherlands in the animal farming. And this research highlights how each different antibiotic that are using, for example, in intensive farming, this is the percentage in terms of increasing resistance. It means that these antibiotics work less to any sort of disease to the animals. And also the ciprofloxacin, that is one of the most used, for example, for the pigs, is shown that in 2022 there was a 62.9 resistance, higher to the previous years. It means that it's pretty dangerous, because if the same disease happen again into the pig, it means that the farmers don't have the exactly antivirals and exactly the antibiotics to treat this disease. So you can imagine how, because we're talking about Netherlands, that is one of the higher intensive production of the meat in all Europe, the overuse of these antibiotics has created what we see, all this resistance to the most important drugs, and of course antivirals. Of course, this is transmitted straight into the meats, because the aims of this farm is not just to produce, for example, the milk, but also to sell the meat to all the European countries, and also overseas, outside the European country. So the problem is, using, for example, the previous case study, just to have an idea, just to understand that this problem is not just correlated to the fact that this animal, because there is an overuse of antivirals or antibiotics, create this high resistance. So there, in terms of risks of loss on the animal production for the farmers, but this represent also risk for the health of the humans, because of course the thousands of tons of meat that are sold from the Netherlands, of course, are consumed in almost all the European countries. It means that this resistance is quite easy that can be transmitted into the humans. So that's the reason why it's very important to understand how this problem is not just a national problem, but is a global problem. So this is another way how to show at the global level, for example, the trend in antimicrobial use in food producing animals. So we have three different graphs. So in the first graph, the white bar generally is represented by the antimicrobial consumption, the white one. The other one colored is represented, for example, by the consuming the projection of 2030. So in any sort of different cases, we will see that we will be in any country, so not just on China and Southeast Asia, but also in the USA, in European country, in Iran, in Thailand, and in Pakistan as well, in Australia as well. Australia, for example, are specialized in the sheep. The projection of this study, of this research, showed that just by 2030 there will be an increasing in any sort of country and in any sort of different antimicrobial. So you can imagine how this problem will continue to grow. So even if there are several frameworks, there are several protocols to be applied at farm level, also in the healthcare sector as well. Anyway, in terms of animal production, in terms of farming, the projection present this data in terms of continuing increasing of the antimicrobial. This will be translated into the fact that we will continue to have an increasing problem in terms of human health resistance towards these antimicrobials, in terms of antibiotics, antivirals, and so on. This graph represent the most concentrated distribution of veterinary antimicrobial consumption. You will see, for example, that the Asia and Southeast Asia represent the higher concentration. Why represent the higher concentration? Represent the higher concentration because, first of all, there is less control and less protocols into the farming. Also because in that specific country, historically, there was the presence of higher episode of viruses that affect the animal farming. So there are two components. That's the reason why are more concentrated in Asia instead, for example, in the USA or in European country. So the link between the antimicrobial resistance and food security, we'll see that there is the relationship to the food security in terms of food production and antimicrobials in terms of the risks of losses in animal production, losses in crops. At the same time, you can imagine, especially from the country with a low income, that the farming system represents the first source of food. This represents a higher risk for the entire population, especially when some viruses affect the entire the farming systems. So we have a problem correlated also to the supply and the demand of all the meat products, the milk, and all the milk derived product from the milk. However, there is an intensive use of antimicrobials raises concern by the antimicrobial resistance. Why? Because the overuse and misuse of this agent can lead to development of resistant strains of bacteria. We see that also another problem correlated to the food supply and food security is, first of all, to ensure the availability in terms of the amount of food, not just talking about the meat, the milk, and the product that coming from the animals, but also from all the crops, because we see also that the antimicrobial resistance is also diffused and used in the crops. The accessibility, because of course, if we're talking about, for example, Thailand, if there is a disease that affects all the meat inside their country, of course, because we are not talking about a country with a high level of income, this country we will face a shortage in terms, for example, of any sort of proteins from the animals, from the food production, and this of course will affect the food security and also the affordability. As soon as there is an infection, a disease that reduces and kills the animals, of course, because the demand remains stable, the supply reduces, and from the economic point of view, it's quite easy to understand how the price will rise and will not more affordable for the low-income people. So this problem is not just a problem correlated to the human health and animal health, but it's also problem correlated also to the food security. There are several ways how we can promote and the growth in a sustainable way, of course, using a sustainable practice in terms of apply the exactly amount of antimicrobials and antivirals to the animals. Also, the approach involves in low doses of antibiotics to the livestock. So, in some way, we have to change the way how we continue to overuse the antibiotics. It's like the same problem, for example, is for the fertilizer. The mineral fertilizer, the nitrogen fertilizer, in old agriculture, in intensive agriculture, is used 2 or 3 times higher than the recommended amount. This, of course, create tremendous impact of to the water, to the lakes, to the rivers, and indirectly create a problem to the water contamination. So, first of all, we have to have an approach, because the growth of animal agriculture is extremely important to survive, to guarantee the food security, but at the same time, it's very important that we develop technology, or anyway controlling and preventing this disease using the right amount and exactly the right antibiotics, without exaggerating in the use, because the overuse in some way reduce the risk to the farmers that their the livestock will be killed by the disease, but the other problem is correlated to the environment and to the human health in terms of increasing resistance to this antimicrobial. The growth production, of course, is correlated to the meeting global food demand, economic benefit for farmers industry, because continue to repeat that the farmers overuse the antibiotics, for example, because the aim is not just to produce, but the aim is to create a profit. So, of course, we're talking about a private company that their own the object and aims of this company to create a profit, so to reduce the risks that they lost their profit because they lost their animals into the farm caused by disease, they overuse the antibiotics. So another problem is ensuring food security, as we already say, responsible practice for sustainable food production, and ethical consideration. That ethical consideration are correlated to the way how we can guarantee the food also to the low, for example, to the low income region. The disease prevention can be in some way development to ensuring animal health for sustainable food production, balancing disease prevention with responsible antimicrobial use, and also safeguarding animal welfare. So there are different ways how we can prevent the disease. Then there is the problem not just to prevent the disease, but the problem is correlated to manage the disease. So once we are into an emergency situation, if we don't have any sort of a policy to prevent, any sort of data, any sort of collaboration between different countries in terms of managing this disease or these viruses, of course, all the second aspect in terms of managing and mitigating the impact of these viruses is much more complicated and hard. Another case studies, because generally when we're talking about the antimicrobials, we always thinking about the animal farming. But another huge problem is correlated exactly in the same amount, exactly like into the animal farm, into the aquaculture. Aquaculture is one of the most fast-growing sector in the food production and food supply around the world. There is any sector that grow like the aquaculture. And the Asia, generally China, India, and Southeast Asia are the country that produce more respect, for example, to the United States, to the Canada, to the European country, to the Australia, and so on. So Asia generally dominated the world aquaculture sector, generating almost the 90% of its total annual global production. So we're talking about the fish, shrimp, mollusks, and mainly farmed in land-based pond of aquaculture systems and serve as primary protein sources for millions of people. So most of the fish, mollusks, and that are growing to the aquaculture in Asia are consumed in Asia, but also are exported. We're talking about trillion of tons of fish that are sold in their own country, but also are exported. And of course, all the farms that operate, this is another slide to show you just the percentage. Look, just you can see how the China, India, and Indonesia just represent almost the 75% of the worldwide production. And all the aquaculture have exactly the same problem, because all the farmers that operate into the aquaculture have the same approach like the inland farm of the cow, of the pig, and so on. So we have the exactly same problem of the overuse the antibiotics, because to reduce the risks that the fish can be affected by any sort of a virus, they use too much, they give too much antibiotics, and the antibiotics have the exactly same path in terms of creating resistance. With the fish is higher. For example, of the raw fish, especially if you're eating the fish, even if now there is some technological treatment that you put the fish, you can eat raw without cooking if stay more than 1 hour minus 40 degrees. Anyway, there are several countries, several restaurants or production company that don't use exactly these treatments, and it's easier if you eat, if we consume raw fish to have for example, antibiotics that go straight into our body, and our body will develop resistance. So the problem is higher in the aquaculture compared to the inland farming. So, in antibiotics in aquaculture are generally administered to the entire population, including sick, healthy, and caring individuals. Aquatic species under product are stressful conditions in aquaculture are more susceptible to bacterial infection. So the result are exactly like the other one in terms of animal. So we're talking about the fish, we have exactly the same problem. And the application of antibiotics in fin fish, for example, has often been questioned over the last decade in Asian countries because of lack of institutional education, training, provision of disease diagnosis. So that's one of the most scary problem correlated to the overuse of these antimicrobials, because these countries have less protocols, they have less control, especially when we're talking about small or maybe medium size aquaculture. There is no prevention into disease, there is a lack of data related to the spread of this disease into the aquaculture, and they continue to overuse the antibiotics. So we have in some way several problems in Indonesia, especially to the aquaculture. And because we have to consider this sector, because as we see previously, we're talking about a sector that is the fast growing sector in all the food production. So the aquaculture in a CAA country is a sector of a constrained growth. And also there is a country like Cambodia, Indonesia, Malaysia, Myanmar, Philippines, Thailand, and Vietnam that represent, for example, ranking almost all the top 25 in terms of aquaculture volume. So we're talking about millions of tons that are producing every year, and there is a continuing increasing demand and production. There is a Suyamud et al. Research that you will find it extremely interesting, and I really recommend to read this their publication, because they will cover all the aspects, so not just from the biological antibiotics point of view, but also the presence and data, just to understand, to have an idea, an holistic approach to this problem, because this problem is not just correlated to their own country, but it's correlated to the global trade of the fish that coming from the aquaculture from this country. So there is, of course, in Asia, there is a systematic misuse, overuse of antibiotics, also in human medicine. The controlling of AMR requires both national and international action involvement across all stakeholders, including government and research and the entire society. So if you utilize a way to control, I didn't say that to reduce or eliminate this problem, is a very important the collaboration. Is also very important. For example, the World Health Organization create a global action plan on specific on MIR in 2016, and there is also collaboration with the Food Agriculture Organization, the World Animal Health Organization. So if we would like to control and to mitigate and to reduce this problem, first of all, it's important that the collaboration among these different organizations, the control of this disease at the regional and national level, but also to implement a strategy and a policy that in some way can reduce or mitigate this impact and reduce also the amount of the the antimicrobials that are used in the aquaculture. So the mitigation strategy for the future, of course, most of these mitigation are very technically. So this is not the ground, this lecture to discuss all the mitigation in terms of using different antibiotics or antivirals. But this is just to have an idea, a broad idea of how we can mitigate and reduce the antimicrobials, antibiotics in animal production. First of all is the implementation of strict biosecurity. So biosecurity is based on the principle of segregation, cleaning, disinfection at any sort of farm level, but also at the national level in any sort of the farming systems. So prevent pathogen from outside and their spreading among animals on farm. Eliminate pathogen also from any possible infected materials in farm by carefully cleaning and disinfection process. So the first measure is to the implementation strictly biosecure. Of course, the Western country have a higher level of biosecurity also in their border. In several countries, for example, in the region, for example, in Southeast Asia, they have less strictly biosecurity rules, law, and inspection. That's the reason why it's much harder to control and prevent the spreading and the overuse of antimicrobials. Good vaccination schedule. This is one of the most important aspect for the animal from the veterinary point of view. So a vaccine is a biological product that stimulates the animal to produce immunity to particular disease. So as soon as vaccination is considered one of the most important methods to effectively prevent disease, if we can prevent disease and reduce disease, of course, we don't need to give to the animals an overuse of antibiotics, or maybe don't use the antibiotics in some specific time of period, because if the animals are in well condition, of course this reduce the demand and the amount of antimicrobials to the animals. So the vaccination is another measure to control and prevent and reduce the overuse of antibiotics. Improvement of animal health with a good feed additive. So there are two different generally way how we can in some way give to the animals something different from the antibiotics in terms of developing their resistance toward the disease. For example, the use of probiotics, that is a live microorganism which, when administered in adequate amount, confer a health benefit on the host, on the animal. The probiotic supplements increase the growth of beneficial microorganisms in the digestive system, which limit the development of harmful bacteria, decrease the number, and therefore reduce the risk of disease. Then we have also the organic acids. This is a supplement, organic acid in drinking water or animal feeding decrease the pH in intestine, that making development less suitable for harmful bacteria and therefore increase the development of beneficial bacteria. Then there is all the science correlated to the use of herbal medicine. So there are different herbal medicine that are, of course, we're talking about some bioproducts that stimulate in some way the digestive activity and in some way increase the well-being, increase the resistance of the animals towards any sort of disease of infections. So this is a different way how we can use and control and reduce the overuse of the antibiotics. As soon as, especially all the animal farming, are in a good condition, as soon as we don't need to overuse and reduce the risks of the MIR that we discussed in this lecture. Also, the surveillance and the monitoring problem. This is just, this slide is to recap what we say. So, talking about from One Health concept, we will see how, when we consider the problem correlated to the overuse of the antibiotics and the increasing the resistance, we have to focus the attention on these three big broad area. First is the human activity in terms of production, in terms of animal production, in terms of human activity, in terms of the medicine, the prescription of the antibiotics into the humans. Of course, the animal, wildlife and breeding are in continuing contact with the humans through the agriculture production, to the consumption of the meat, to the consumption of the crop, and also the environment, of course, because we will see how the environment is affected by the water contamination that where can affect the crops. The crops, of course, are consumed by the humans. So these are all interconnected area. And the One Health concept aims to have this holistic approach in terms of treating this aspect. Of course, the antibiotic resistance surveillance system is extremely important to collect, first of all, data sources from hospital laboratories, from also from the veterinary sector as well. The data analysis, of course, is extremely important because we can create an indicators or prevalence or presence of some specific disease, and this can generate a weekly, monthly, and annual report to have an idea how, for example, how the disease is spreading, which regions are affected, the percentage, for example, of the humans or animals that are affected, and so on. So, remember this approach in terms of solving this and monitoring this problem correlated to the overuse or misuse of antimicrobials and the development of resistance, but it is very important that we use the One Health approach. There is, as I said before, several ways emerging technology and innovation for sustainable solution. This is just to conclude. Of course, we cannot treat in this lecture any sort of different specific diseases such as influenza, dengue, HIV, Ebola. There are several different viruses that can be transmitted from human to human, but there are also different viruses can be transmitted from animals to humans. So the emerging technology will help in the near future to in some way solve, but in some way also to reduce the overuse of the antibiotics. This is just the summary. To recap this lecture, we will see we defined the different use and misuse of the antibiotics and antimicrobial in human and in the animal farming. We will see how there are several ways how this resistance to the antimicrobials can be transmitted from animals to the humans. We will discuss the One Health approach, and we emphasize the interconnection of the human, animal, and environment. This is extremely important when we are to thinking about any sort of surveillance, monitoring, controlling of this disease. So it's very important that we using this approach because it's a multidisciplinary problem that affects human, environment, and all the animals. We will see also, for example, the specific case of also the aquaculture. So it's also correlated to the production of any sort of the fishing in the aquaculture. And also we will see how we can, in some way, using sustainable policy and solution in terms of creating alternative biological reaction into the animals so that in some way reduce the demand and reduce the disease in animals, so we can reduce the amount of antimicrobials that we give to the animal, generally to the farming systems. This slide there is all the reference. We will see all those references that are cited into this lecture, and there is the recommended readings. So there are a couple of very interesting publications that I already introducing during this lecture. Thank you very much for your kind attention.